This is Aimee Gutierrez with Ask the Doctor. And today, as the host of this awesome show, we get to dive deep into the mind of some amazing doctors. And on today's topic, it's going to be all about the mind, addressing depression and anxiety. Thankfully, we have a world-renowned doctor who I don't think we could find someone better to discuss this topic with us, Dr. Nedley. Thank you so much for being here with us today. But before we discuss areas that we need to tweak and improve in our mind, I want to hear what's right with you. How are you? And what do you think is the most amazing part of our mind?
Well, thank you so much for having me, Amy. And yes, our mind is indeed the most complex and wonderful structure ever investigated by science. Just the amazing ability for it to repair itself, the amazing ability for neuroplasticity, for the brain to change, and also just the billions of nerve cells and connections and how reconnections can be established. And of course, all the chemical and electrical aspects of it. It's more complex than the space shuttle. It's more complex than the most complex things that we have investigated. And as far as living creatures, there's nothing more profound than the human brain, and particularly that frontal lobe of the human brain that allows us to accomplish advanced planning and thinking and wonderful creative abilities.
That's incredible. I can't wait to dive more into a few of those topics already sparked my interest, like neuroplasticity. But before we jump there, I want to understand at a basic level, what's the difference between anxiety, depression level where it's clinical and just someone having a bad day?
So there have to be five of at least nine symptoms for at least 2 weeks before it's classified as clinical depression or major depressive disorder. And so those symptoms have to do with apathy, where you wake up in the morning, you're not excited about the day, feeling down or depressed. Those are the two most common that people think of in regards to depression. But there's other ones like fatigue, decrease in focus, sleep disturbance, weight or appetite changes, an increase in irritability. And then as it gets more severe, you can get into feelings of worthlessness and even morbid thoughts. So you only need five out of those nine in order to qualify for major depression. And that's how the diagnosis is made as long as it's been there for 2 weeks.
Speaking of that, I see a lot of those symptoms that you're talking about around us in a lot of people. I know that global projections of depression have been on an incredible rise, from what I understand. What do you believe is driving this increase? And is it the same for anxiety?
So it actually is. The similar causes are behind both. And so we're often seeing both together. In fact, in our residential program, 80% of people with depression have anxiety and vice versa. And once we take care of the underlying cause of both, they both actually get remarkably better. And the world doesn't quite understand that. They think depression is actually easier to treat than anxiety. But if we get to the underlying cause, anxiety is actually easier to treat than depression, although they're both pretty easy once we start reversing those causes. But back to the question, why is it increasing? And it actually is increasing. It's not just the perception. Taking a look at those symptoms that we talked about, that constellation of symptoms is dramatically increasing, particularly among young people. But actually, every generation, even older people, have much higher rates of depression and anxiety than they used to. And there are several things driving it, but maybe the one that's most important that's driving it is actually the use of smartphones. What happens when 50% of the population of any country owns a smartphone? Rates of depression and anxiety skyrocket. And it actually has to do with how people tend to use a smartphone. In fact, if we use a smartphone the way the engineers want us to, we are going to suffer a cognitive penalty as a result. And so, what happened with the smartphone is when you get on your smartphone to do something useful, within 3 minutes, studies show vast majority of people are no longer doing something useful that they were planning on doing because they got distracted. And so, if the person on the phone, the engineers know he likes BMWs, there'll be a little BMW floating across the screen. The new A5 is at your BMW dealer. Oh, I knew it was coming out, but not so soon. Let me just click and see what that is about. And as they're clicking and looking at that, a newsflash notification comes out that Donald Trump just got handcuffed and put in a New York City jail. Oh, I've got to see the look on his face. I've got to see what the right says about it, what the left says about it. Then a friend sends a Snapchat. If you don't look at that picture, you're going to miss what your friend's doing. And as you're interested in what your friend's doing, then another friend comes in with a text message that you feel you need to answer. Now an hour has gone by and you're wondering, why did I get on this phone? Oh, yeah, that useful thing that I didn't quite finish. And so this division of attention, constantly dividing attention, focus is at an all-time low in society because when we don't have to focus for long periods of time, the anterior cingulate gyrus, it's in the frontal lobe, begins to prune itself down. It says this human being doesn't focus for a long period of time on anything. It doesn't need me. And as it prunes this area down, unfortunately, that's also the area where we manage distressing emotions. And so if we can't focus, we can't manage distressing emotions.
There's so much to unpack there. I feel like my mind was blown just listening to all of that. A question I had is I take it and I just want to reword this in another way too, is that neuroplasticity of our brain. It seems like this has a connection with this topic, like in a negative side, like we're able to really change our brain by having technology or some of these other things. And it's creating this super undesired effect in our society from that.
No, that's an insightful observation because in order to have positive neuroplasticity, now in what you said is correct, there is negative neuroplasticity. Our brains can change for the worse. And there are certain lifestyle habits and things that we do that can dramatically depress our brain and also decrease our frontal lobe ability. And when we decrease our frontal lobe ability, we're not ourself anymore. And we are not going to be able to even have good willpower or decision-making ability. And so we can have negative neuroplasticity, but we can also have positive neuroplasticity. But interestingly, what sets the groundwork for our brain to change for the better is an improvement in circulation and activity of the frontal lobe. And these smartphones, the way they're used, it's actually doing the opposite. But there are different habits and things that we can establish that can greatly improve that frontal lobe function and then open the door to the brain changing dramatically for the better.
That's speaking for just a second on some of the positives that you were mentioning with this. I remember reading about Ben Carson's mom taking TV away from him, I think it was when he was younger, and making him read books and the difference in his grades and things that came from that. Can you tell us a couple of quick thoughts on areas that we could do to create our neuroplasticity to change this effect? We've probably all had experiences with using smartphones too much. What are some ways that we can counterbalance that and build this frontal lobe bigger instead of reversing that damage?
Well, you've touched on one already, and that is reading good and interesting books that can advance our knowledge and our education and can be useful. So that's what Ben Carson switched to instead of rapid scene of reference entertainment television. So entertainment television changes its scene of reference every 3 to 5 seconds. And as a result, within a minute and a half to 3 minutes, the frontal lobe is dormant when we watch entertainment TV or movies. The limbic system is still working. The emotions are working. The memory is working. We can recognize that we saw a rerun, 10 years later, but we're no longer critically analyzing the information that comes in. And so there's 17 different depressed areas that start to occur in the frontal lobe when we get on a regular diet of entertainment television. And unfortunately, Ben Carson was in that. And, his mother had three jobs and he wasn't being supervised very much. And so he and his brother were just watching TV and their emotions were out of control. And he almost went to jail for, in fact, would have had the knife that he threw at a kid not hit a belt buckle. And then his mother had enough insight to get rid of the TV unless they wrote two book reports every week from the Detroit Public Library. And so they started checking out books and started learning and not doing TV. And within a year, he went to the top of his class. His frontal lobe had awakened, no longer frontal lobe suppressing. Now it's frontal lobe enhancing, and what a difference it made. But there's other things that we can do too, like our tastes of, or not just taste, but the choices of music. Some can suppress the frontal lobe, some can enhance it. We also have nutrition. There are certain nutrition things that will actually suppress the frontal lobe of the brain, and there's other widely available nutrients that can greatly enhance the frontal lobe of the brain. Physical exercise helps it. Working with our hands in three dimensions is actually something, if we do it on a regular basis, that actually has a frontal lobe enhancing activity. Another reason why that farm boy who's not at Harvard is actually has a little better brain in regards to problem solving. And of course, there's a host of others, and so there's a lot of different things that have been researched now on their effect of the brain and the frontal lobe. And one of the things, just to give a bigger picture, um, studies show that virtually every depressed and anxious person has a suppressed frontal lobe. And so, one of the ways of really transforming the brain is to take it from suppression to enhanced. And we can actually do this within 10 days in a residential program. And the patients that come back to their families, they're just amazed. How has this person been transformed? They are themselves. They're happy. They're productive. They're they're just a whole different person. Their basic personality and who they are is there. It's not like they've become, someone different than what their genetic personality is, or what their environmental personality is. But it's just been so enhanced in every area. And so it's not the only secret, but it's probably the largest secret of our program in regards to comparison of other programs is what we're doing with the frontal lobe to actually have this person become self-determined again. We can't have really self-determination in a wise and effective way unless we have a good frontal lobe, which is what humanity was designed to have.
That is so fascinating. You were speaking a little bit about your in-person residential program, and I know that your program has been shown to have a 90% effectiveness rate, which is incredible. That's, I think, the highest out there from what I understand. Um, what
It's
drove
actually
you?
actually higher than that,
Okay,
but yeah, and 90%, when I say what it is, a lot of people start to misbelieve until they actually come through the program.
it's a pretty
But
amazing program.
but yeah, it's not 100%. I will tell you that, and I'll tell you why it's not. But it is in the high 90s. It's above 95%. Yeah.
That's incredible. So, what drove you as an internal medicine physician to create this program, and how does it work that you can have this kind of response?
Yeah, so a good question. A lot of people ask, how did an internal medicine doctor get involved so much in the brain? Well, internal medicine is adult diseases of the internal organs, and the brain is one of those organs. So I had neurology training, psychiatric training as well, because we are looking at how one organ affects the other a lot. And so, internal medicine people are who you go to for the difficult to diagnose patient. That's one of my specialties. And when the basic training of internal medicine is not just to have a disease and know how to treat it medically. And so some people get that misnomer because it says internal medicine. It's like these are the people that know all the pharmaceuticals and medications, which they should. But it actually is deeper than that. We want to find the cause of the disease. And we were trained that when we see a patient with swollen feet, we don't diagnose them with swollen foot syndrome and send them out the door with a diuretic to get rid of fluid. We want to find the cause of the swollen feet. And there's over 100 different causes of swollen feet. But once we find the cause, we have much higher likelihood of curing the patient. So as I saw depression and anxiety increasing, and it was increasing even before the smartphone. It was increasing even in the late 90s, but not exponentially so much as it is now. I recognized that the way it was commonly treated is depression was diagnosed, then we went straight to medicine. And then, of course, we had to continue to see the patient and follow up because the medicine would eventually quit working or it wouldn't work enough. And then we'd have to raise the dose and then add another medicine and all of this sort of thing. And I'm recognizing no one's actually looking for the cause. Why is the serotonin level low? We're giving a patient an SSRI because we want them to have more serotonin activity. But why is it low? Is the neuron not making enough? Are there not enough receptors? What can we find out about the underlying cause? And so that's when I began to research extensively the causes of depression. At the time, I didn't realize that no one had done an extensive literature search of all the causes. Well, you can't work something up unless you know what causes to look for. So you have to actually know about every cause potentially for depression. And I found out depression is a multifactorial disease. The brain can actually undergo one cause, two cause, three different categories of causes, still function pretty well because of the resiliency. That's another wonderful thing about our brain. But once we have four different categories, it's going to happen in anyone. And the more categories, the more severe the depression. But most of these categories are reversible. One of them has to do with nutrition. Another one has to do with your level of physical fitness. Another one has to do with how much time are you inside versus outside. Outside air has some significant benefits, as well as the sunshine and the essential oils that come from the leaves of the trees. These are all things that can enhance the brain. And then it has to do with habits. What are our habits doing with our frontal lobe of our brain? And then there are medical causes like thyroid, autoimmune disease, traumatic brain injury, but there are things that we can do about those medical causes that can help. Then there's social and stress causes, adverse childhood experiences. And one of the most exciting is what we've been able to do in our research on genetics. Yes, if you have a genetic mutation, that's one category of cause. It's not enough to cause it. But now we've been able to determine not only what mutation is present, but to what degree it's being expressed, and we can reverse that through epigenetics. This is where we do utilize nutrition and lifestyle. Then we can measure the effects and find out the genetic mutation is no longer being expressed. And this is foundational in regards to being able to have that complete transformation. And so, as we started to get into this and started treating patients, I began to just in the community by word of mouth, everyone was sending their depressed and anxious relatives to our clinic. And our receptionist said, "You can't see every depressed patient in this town. You know, you need to explain what you're doing." And that's when we came out with our book and our community program and then our residential program, because some people, even reading a book, they can't put it into practice. They're too depressed or anxious. And or they're in such a state of being that they can't have the resources to really change their lifestyle. And so that's why we allowed the residential program to surface. And that's the one that has over the 95% success because we're able to monitor them, encourage them, see them every day, and get that dramatic transformation within a few days.
That's incredible. I want to continue on with this topic because there's so much to discuss. But before we keep going, we're going to take a second to hear from some questions that our viewers have brought to us.
My son seems to be exhibiting signs of depression and he is 9 years old. Is it possible for children that young to be clinically depressed?
The answer to that is yes, absolutely yes. So, when does depression start to occur in young children? It's actually about age 5. So you can
Mm.
have a very terrible life, and a young child might have anxiety. Anxiety can occur, even as an infant. But depression, you need to be able to reflect upon yourself to have depression. And so that means the frontal lobe actually has to grow enough to be able to reflect upon yourself. So, yes, we've seen suicidal ideation and suicidal behavior is in young children as young as 5.
Wow.
And then at age 6 and 7, as the frontal lobe grows, they can have even more depression. Now, I don't get discouraged by that because in fact, I've had to tell our team this in regards to these children that think they would be better off dead. I get encouraged because I know if they're thinking that, they have a frontal lobe. That means they are able to reflect upon themselves. And even though their frontal lobe isn't working well, I know it can change. And so when we get that frontal lobe changing, that transformation can occur even in a young child.
My son uses cannabis to deal with his leg injury pain, but sometimes it induces anxiety. Should he stop the cannabis?
Yes, he should. There are far better ways of pain control than cannabis. So, cannabis is short-term gain, long-term problems. And it's actually been shown not to be very good, even as far as efficacy for pain. There is an indication for, end stage cancer causing pain. But if it's non-cancer causing pain, the risks actually significantly outweigh the benefits. And so, yes, anxiety is going to increase. Depression will likely follow. It will decrease their ability to learn, retain, and apply knowledge. That means it reduces IQ, and it also reduces emotional intelligence. So it's the emotional intelligence, your ability to manage your emotions, as well as to respond healthfully to the emotions of others. And it's going to decrease your motivation for just about anything except where you're going to get your next marijuana from. So when we look at those side effects for maybe a slight improvement in pain perception, it's simply not worth it. And so we need to go to other routes of improving the pain that are not going to have that type of cognitive penalty.
For someone who is in a meaningful long term relationship which ended badly, how long is it until I can bounce back and feel good again?
Yeah, that's a great question. And this is something that, can induce depression, unexpected and overcoming loss. And of course, there's all sorts of losses. And one of them that we have found in our program that a lot of people don't address is loss of a vision, where you just knew things were going to happen in a particular way, and then you realize no way, no how. And so, in overcoming loss, it depends on us following the healthy tasks for grieving. So, if we don't follow healthy tasks for grieving, that effect of that loss can be there the rest of our life. It can have a cognitive penalty that is very significant. But we actually teach the 5 tasks for healthy grieving. One of those, of course, is to accept the reality of the loss. We can't move on unless we do that. But secondly, is for good self-care. Many people give up their self-care. They give up their good nutrition diet. They give up their exercise program. They give up their spiritual life. And they do things that are self-sabotaging after a loss that's going to really complicate things. So those are two of the most important. And then finally, step 3 is to emotionally relocate the loss.
So, what are some steps that we can take in this active side of it? What are some ways that we can prevent depression and anxiety?
Yeah, so of course, a healthy lifestyle will go a long way. And so, getting or staying on a good physical fitness program. Physical fitness is actually better for our brain than it is our body. We're
Mhm.
actually able to pick up tryptophan and tyrosine into the brain when we have exercised. And we also get those into the neurons far easier as a result of being very sensitive to insulin, which is part of, a good exercise program. We're going to get rid of the potential metabolic factors and insulin resistance that's so common in a lot of people. And then just a healthy diet, less sugar in the diet, less of the bad fats, less cholesterol, and particularly more of the antioxidants. Antioxidants have been shown to be very healthy for the brain and can help prevent a lot of depression and anxiety. And some of those antioxidant vegetables like garlic and kale and spinach and the berries, particularly, are very high in antioxidants, including, plums are also a great source of antioxidants. And even things like eggplant is in the top 10 antioxidant foods. So getting those regular antioxidant fruits and vegetables and even legumes. Legumes are very healthy for us. Lentils are one of the highest sources of folate, black-eyed peas, and of course, seeds. Pumpkin seeds are loaded with both tyrosine and tryptophan, and they're not very expensive. And of course, seeds like chia seeds, flaxseed, these things have been shown to be very healthy for the brain. And then getting on a regular program where we are reading something that has some abstract thought aspects of it. And one of the easiest ways of doing this is spiritual material. For instance, spiritual material that's very good spiritual material is going to be very helpful in resisting depression. For instance, the Bible, when we actually take a look at it, it's much more of a mental health book than even a physical health book, although there's a lot of things there about physical health as well. And there's so many cases of characters, even great characters in the Bible that had mental health issues. And you can see kind of what caused those and what the reversal can be. And there's so many good abstract concepts that we can grasp onto and hold on to that can help us in our frontal lobe circulation. And so a devotional life, consistent devotional life will help us. And then also, very important, sleep. We need our rest, but not too much rest. Studies show over 9 hours of sleep every day for an adult will actually increase their risk of depression and anxiety. But we need somewhere between 6 and 9 for most people, and most people it's more like 7.5. So, and then studies show the earlier we go to bed, the more melatonin we make, and so early to bed, early to rise is one of the treatments and preventions for depression. It's actually been shown to be as effective as Prozac in helping depression, just changing our bedtime and our circadian rhythm that way. So those are a few things that we can do for that ounce of prevention.
Thank you for sharing that with us. This was an awesome experience to have this conversation, and I know our viewers are going to be blessed with what you shared today. If you've enjoyed this week's episode of Ask the Doctor, please join us for the next episode as the conversations are still ongoing. In fact, if you can be a part of this conversation, if you would like to submit your questions to askthedoctor@3abn.ca. Thanks for watching.